Welcome everyone. Thanks for joining us today. My name is Vance Drakeford. I'm a Practice Transformation Advisor at the Kentucky REC, and I'm joined by my colleague Jessica Elliott. Today we're going to be speaking with everyone about the interpretation of the Quality Payment Program feedback reports for performance year 2023. Now before we start, notice at the bottom of the slide we've listed our legal description. I won't read through that, but just know that we try to keep everything as up to date and accurate as possible. So our agenda for the presentation, I'll be starting off and speaking about the Quality Payment Program's 2023 scoring and giving you a little bit of a refresher about the timeline and how those thresholds work. Then we're going to jump on into how to access your feedback report in the portal. And then I'm going to pass it on to Jessica, and she's going to dive into that performance feedback and those details and really give you some information on how to analyze that to make improvements. So let's jump into the scoring. This final score preview gives you the opportunity to look at your final score before they release that payment adjustment information. As a reminder, your final scores for calendar year 2023 will determine that 2025 MIPS payment adjustment. Make sure the scores are as accurate as possible, and if you notice anything wrong, then you can start preparing for a targeted review when that is opened and be able to submit for that. What you are able to see now with this final score preview is the final score, any category level scores and their weights, the bonus points and improvement scoring, any measure level performance data and scores, activity level scores, and then supplemental reports for administrative claims for quality and cost measures. And if you submit it as an MVP, then you can see some comparative quality and cost feedback. Now just remember, your preview does not show the payment adjustment yet. It'll just have all this other information for now. Let's look at the timeline in this year for all of this information. We want to remind you that in the final rule for last year, CMS did state that there would be 2 targeted review periods. At this time, there does not seem to be the link for the targeted review working. So you're just able to preview your information, start preparing if you think there's a reason that you do need to submit a targeted review. So just know that that link probably won't open until August at this time. But you can start preparing for that. And also, virtual groups and subgroups can now submit a request for a targeted review as well. So looking at the timeline, we submitted by the end of March was that deadline, and in June that final score preview was released, and so now you can start preparing for a targeted review if necessary. This preview period, targeted review period, will close sometime the end of July, we believe. That's when it's supposed to, and then that payment adjustment release is supposed to happen mid to late August. And then at that time, you'll have 30 days from when they release that payment adjustment to submit a targeted review if you need to. Then they'll review all of the targeted review information and finalize all those by the end of the year, is in December, so that the payment adjustments are ready to go for that January 2025 start period for the payment adjustments. So if you believe, once you've reviewed all this information and you think we do need to submit a targeted review, well, this is your time to do that when they open that link, and some valid reasons that you could submit a review. We've listed them here on the slides. Some of them might be, hey, we've submitted all the quality measures that were available, and we only had 4 quality measures, for example, that were able. But they did not reduce the denominator. That would be a valid reason. If you submitted data under the incorrect tax ID number, that's another valid reason. But let's say that your payment adjustment was low. That's not a valid reason just because you got a low payment adjustment. Or, hey, they changed my score. That's not a valid reason either to submit one. Now, if you are submitting a targeted review due to uncontrollable or extreme circumstances, you must be ready to show documentation and have that ready to submit. Also, there's time limitations to when to submit this. The targeted review period will open, on that link will open, when they release that final payment adjustment. When that's released, then you'll have 30 days to submit that. And that's what we believe will be ending sometime in September, October. So your MIPS final score is going to be between 0 and 100 points. And the thing to remember most is to avoid penalty is 75 points or higher. So that is the threshold to avoid penalty. Anything above 75 points, then there's a positive payment adjustment. Anything below 75 points would be a negative payment adjustment. And the lower your score, then the bigger your negative adjustment. The higher your score above 75, then the bigger your positive adjustment. And so we can't project what that payment adjustment is going to be because this is a budget neutral program. So anything that generally means the size of your payment adjustments depends on your overall participation and the performance of everybody in the program for that year. So, how do you access these reports? First of all, you have to have a HARP account. If you do not have a HARP account, then that is the link to go to HARP, register, and get that HARP account started. And there's also a link to the Access User Guide to how to do that. So those are some good resources if you do not have that already. You will need to have a user role for your organization in order to get that started. And you have to use your latest version of Microsoft Edge or Chrome in order to access this system. Then once you have that in place, then you can log into the Quality Payment Programs portal. The link, that is the link. You'll enter your information, your user ID and password, and do that. Your password does expire every 90 days. You will have to update that. That is so aggravating, but that is a feature that you will have to do. You can look at your group and individual feedback once you get into the portal and print that information out so you'll have it for your records, save it on your computer, and then review that so you make sure everything is accurate as possible. There are different organization types and user roles within the QPP portal. So first, there's a practice representative. So that is a representative for a single tax ID number. You can have a staff or security official QPP role. These people can look at individual, group, subgroup, and review and submit the data for that tax ID number or that organization. There's also a role for individual clinicians. This requires you to have an NPI, and you can only review data only. You cannot do any types of submissions with this role. There's also an APM organization type that includes shared savings plans, ACOs, and you can have a staff or security official QPP role for APMs that's identified by that APM entity ID. Now, this type allows for submission of any quality, and you can review quality feedback as well. And then there's virtual groups. Now, this is a staff or security QPP role for virtual groups that's identified by your virtual group ID, and it allows for submission of data as a group, and you're able to review quality feedback as well. Now, for this year, only authorized, or starting this year, I should say, only authorized practice representatives can access performance feedback, including final score previews. The Centers for Medicare and Medicaid, CMS, doesn't grant direct access to performance feedback for third-party intermediaries anymore. So that's your QCDRs, your registries, those type of entities. So they're only able to view what they submit on your behalf and that information, but they can't see your score, your specific level data reports, those kind of things. Once you log into your QPP portal and you want to preview your score, there's two ways to do that. You can click on the left on that list there under performance feedback, or that preview the final score there in the middle of the slide. You're going to see a pop-up box at this point that you must select yes, I agree. And this is your acknowledging that you understand this is a preview of your final score and that score could change. And then you would click the OK button. You'll have two things in your menu items there. It'll say performance feedback and then those reports. Your performance feedback, that's where you can get all the 2023 performance feedback information. The reports tab, that's where you can find information if you did a CAHPS for MIPS surveys, look at historical CMS web interface reports if you had those, and then any type of historical payment adjustment reports as well. So to get your feedback report, if you have access to multiple types of organizations such as APMs and a regular practice, then make sure you click on the appropriate one. In this case, say selected practice, and then it'll shoot up another pop-up screen where you can download that data, and your score submission for your entire practice will be there. You can download that, and you can also see your connected clinicians as well. If you do group feedback, then the same thing. You could hit view practice details next to the group, and then view group feedback once that pops up. And then there you'll have all your connected clinicians that are receiving that score, and then you can look at the individual feedback for each of those connected clinicians as well. And then if you have subgroup feedback, this just shows you what that looks like. It's all very similar, and then you can view that group feedback. Is not going to display if your final score isn't attributed to at least one clinician in the subgroup. So just know that. Now I'm going to stop speaking and I'm going to transition this to Jessica, and she's going to dive into those details about the feedback and how to analyze that information. Jessica?
Let's start out with taking a look at some of the screen grabs that you could see as you navigate through the QPP portal and your feedback reports. So one of the first things you're going to see is your final score preview. This is going to be your total score, all of the points achieved combined across all of the performance categories, including any bonus points such as the complex patient bonus. You're going to be able to see at what level your score was calculated and how it was calculated. So you can see right here that this was a group level submission for traditional MIPS, and the box below is based on facility-based scoring at that individual clinician level. Now, whenever you go and you open it up, you're going to be able to see all 4 performance categories and your high-level overview score for each of the quality, PI, improvement activities, and cost. Now, from here, you can drill down a little bit deeper, and we'll do that here in a few minutes. But you can click on any of those red highlighted boxes to view details that will take you into more of a drill down level around your individual scores, around each individual performance measure that you either submitted for or were scored upon. Found within this same page, you're going to see the complex patient bonus that the practice or the individual clinician received. And you can see the total combined score of 6.4286. Keep in mind the complex patient bonus is a composite. It's going to look at social complexity of your patients, and it's also going to look at the medical complexity. And those two get added together to form that complex patient bonus. The complex patient bonus is added to the overall MIPS score. It's not added to quality or one of the other categories. It's actually added on to your final. Now let's take a look at the quality scoring feedback. So if you navigate over to the View Details, that red box that's highlighted, you're going to see a couple different things. You're going to see how your total quality score was calculated. One thing that I do want to highlight on this is the denominator. So you can see on this example that the denominator is 60 total points. Now this is going to be based on the number of measures that were submitted. You're required to submit 6, and that's going to be multiplied by 10 because each measure is worth 10 points. Now sometimes you might find that this denominator changes. If you have administrative claims that have been applied to the quality category, you could get anywhere from 70 to 90 points in your denominator. If there have been measures that have been suppressed during the performance year, you might be able to see that a denominator reduction. So maybe that denominator might be 40 or 50 points instead of 60. Above that, you're going to see the total points that you have earned across your measures, all submission methods, for the quality performance category. It's going to be weighted by 30% because this is a submission from a practice that doesn't have a special designation. But say if you were a small practice, you would see a different category weight here. And then you're going to see your final contribution to your score for quality, and you're going to have earned 25.13 out of 30 points. Digging down into your quality performance details just a little bit further, you're going to see all of the measures that count toward your quality performance score. So these are the measures that scored between 1 and 10 points. You're going to also see measures that were submitted, but perhaps they didn't count because you had higher scores that filled up those eligible 6 quality measure requirements. And then finally, you're going to see those administrative claims that were applied either at the individual or the group level. And those are only going to be the ones that you actually earned a score on. Now from there, we can drill down even further. You can see at the top of the screen, there's a little caret. You would select that, and it's actually going to open up your performance for that individual measure. So this one is looking at primary open-angle glaucoma. You're going to find your numerator and denominator details. You're going to see whether it meets data completeness and what that has been calculated to be as. And then you're going to see your eligible population for that measure, as well as your total measure points and how it compares to that decile benchmark. On the left of that screen grab, you're going to see the range in which you perform. So it's going to have your performance compared to a benchmark and the distribution across that particular measure. Let's talk a little bit about administrative claims feedback. If you do receive this, you are going to go and drill down into those individual measures. It's going to be pretty similar to the feedback that you're seeing around your clinical quality measures that you submitted. You're going to be able to see the benchmark. You're going to be able to see where your individual practice or that clinician fell along the distribution of that benchmark. Something else that I would like to be able to point out to you all is that we are actually going to be getting beneficiary level data around administrative claims measures. Now, this might not be active right now, but as soon as they drop the final score and the final adjustment, here we're expecting around August, you're going to be able to go in and download this report. This is going to be giving you really important information on those different patients that roll up, those different encounters that roll up as well into that particular claims measure. It's going to give you patient information, and it's going to give you other details that you can use as feedback for future quality improvement. One other aspect we want to just make sure that we touch on is quality improvement scoring. Now, not everybody will necessarily get this. For 2023, you would have to have submitted in the quality category in 2022 as well as 2023. And CMS is going to compare your performances to see if you've had an increase from the previous performance year. And if you do have an increase, CMS is going to give you a little bit of an extra percentage to be added on to your quality category score. And so again, just keep in mind that this can be some additional bonus that does get added to help build out and acknowledge the improvement and the work that you've done around this particular category. Let's stop and talk a little bit about eligible measure applicability, or EMA. This is not going to apply to everyone, but you might see this as a part of your feedback report. It's related to clinicians who maybe don't have 6 available quality measures and who've submitted their data as a part of Medicare Part B claims or as MIPS CQMs. And those clinicians, those practices may qualify for the EMA process. This process really looks for those unreported clinically related measures, and it actually can result in a denominator reduction in the quality performance category. You might want to learn more about this process if this is something that has been applied to you. There is a 2023 EMA and denominator reduction guide found at the qpp.cms.gov website in the resource library. Keep in mind, if you submitted fewer than 6 Medicare Part B claims measures or those MIPS CQMs, the quality details page will display a message that indicates whether the submission qualified for EMA or not. Denominator reductions are reflected in that total quality score calculation section. Now let's take a look at facility-based quality scoring. If your quality and your cost scores are based on facility-based scoring, you're not necessarily going to see any measured details. You're actually going to be scored on your hospital VBP program score and that associated percentile rank. So you can see this example right here. The hospital value-based score is 75.29%, and they earned a 98th percentile. That correlates to a 100% performance rate. That's then multiplied by the category weight for MIPS, and this particular clinician or practice actually earned a full quality category score, earning 30 out of 30 points. And this is only applicable to those eligible clinicians who meet the requirement for facility-based designation, that special status, or at the group level if the group itself meets the qualifications for facility-based clinicians and scoring thresholds. Now, our improvement activity scoring feedback. This is going to give us information on the total number of points for the category. The max that you can have is 40, and it's going to look at the total points of what you've submitted. Now, keep in mind that the maximum that you can earn total is 40 points. So you might oversubmit and have more improvement activities that add up to over 40, but CMS is only going to award you a maximum of 15 out of 15 points for this category. Now let's take a look at the improvement activity. So you can drill down, again, just like with our other measures, into a greater amount of detail. You can look at the individual measures that you were submitted for, and you can see those activity scores that were assigned and that weighting, whether they were high or medium weighted activities. They're also going to be able to give you information on any type of special considerations. So you might receive favorable scoring based on special status designations, such as being a small practice or being facility-based or hospital-based. The promoting interoperability category scoring, again, is going to be very similar. Now, with this category, you can earn up to 100 points across all of the measures and objectives that you submit for. You're going to first see your base score, and then you're going to see any performance bonus points that have been awarded. So if you have submitted an additional public health registry public reporting requirement, beyond that requirement, you could receive some additional bonus points that would get applied to your promoting interoperability final score. Again, 30 out of 30 is the maximum that you can earn for this category. Now, diving in, again, you're going to see the individual measures that were calculated for your overall PI score. It's going to give you, if it's a measure that has a numerator and denominator, it's going to give you the total points that you earned, and it's also going to give you the numerator and denominator performance. There are some measures that are attestation only, just like querying of the prescription drug monitoring program. It's going to indicate that yes or no, depending on what you submitted and elected during the attestation period. And it goes through all of those different elements that are a part of that performance, the performance for the PI category. You're going to be able to click on the carets on any of those measures, and it's going to give you some additional information. Obviously, you're not going to get patient level detail because that's not in the way in which this category is submitted, but you're going to be able to get more numerator, denominator details and things like that around your individual scores. Now let's talk very briefly about the APM Promoting Interoperability score. This one is for an APM entity, such as the Shared Savings Program or our MIPS eligible clinicians that reported promoting interoperability as individuals and groups. And we're also going to show how this score was calculated. It's going to look at, and this is again at that APM entity level. So you may see this applied to your clinicians, but it's going to be that total MIPS eligible clinicians in an APM entity. And the denominator is also going to subtract those eligible clinicians who received performance category reweighting. So if you're part of an APM and your clinician does at that individual level receives a special status for reweighting, they are not going to contribute to that APM entity's eligible population, so to speak, for that measure or that denominator. And then again, a very similar calculation to others, it's going to be divided by the total sum of points earned from across all of those ECs that were required to report. And then you also, as an APM entity, you can also earn up to 5 bonus points, depending on if at least one clinician reported an optional measure. And finally, in the PI category feedback, you are going to see your cert ID. You're going to see the time range in which you submitted the category. And just keep in mind as well, cert IDs are required to be able to receive a score for the PI category. If you didn't submit that cert ID, that can be one of those things to troubleshoot with your submission if your PI category score doesn't look right. If you didn't insert your cert ID, you could receive 0 points for the PI category. And finally, our last category is cost scoring. Again, the same methodology is applied. It's going to be looking at a total number of points based on the measures that you were eligible for. So in this particular example, this practice had 24 measures that they were scored on, each worth up to 10 points. So that's why their denominator is 240 points. And then CMS actually adds together the Medicare spending per beneficiary and total per capita cost measures, along with the aggregated scores across all of the episode-based cost measures that a practice would have been scored on. Again, the category weighting for cost scoring is 30 points. And so this particular practice earned 19.06 out of 30 points for the cost performance category. There is additional information, as with the other performance categories, that you can drill down further into. Again, you're going to see the measures only that you were scored on for this category. And you're going to be able to see that individual measure score performance. And then we're going to also take a look and drill down even further. So this, whenever you click on, say, the total per capita cost measure, you're going to be able to see those eligible beneficiaries that were a part of this measure, the denominator, so to speak. You're going to be able to look at the total per capita cost ratio as well as that unadjusted per capita cost. And then you're going to see the contributions of the points that were added for this particular measure and how you scored. There's also an opportunity to download beneficiary level data at this individual measure level. You're going to be receiving an Excel file that you can now use for quality improvement. In this particular measure, it gives information around the patient's identifiers. It's going to have the total HCC percentile rank. It's going to also indicate the 4 main chronic conditions of diabetes, coronary artery disease, COPD, and heart failure, as well as the different sort of buckets of that cost distribution across that patient's continuum of care. One thing to keep in mind is that you do need to be able to meet case minimums for the cost measures. And so you might see that you don't have any scores simply because you did not meet case minimums across any measures. Most measures are going to have between 20 and 30 minimum cases that are required to be scored. And if you, for some reason, don't get scored on a particular measure, it's not going to hurt your overall MIPS score. Your cost category would actually get reweighted to 0, and it would get redistributed across other performance categories. There's several different reweighting scenarios, but the most common one is 25 points would get distributed to quality, and 5 of those 30 points would get distributed to PI. We also have some additional reports that are available through cost, and I kind of alluded to that on that previous slide with total per capita. But you're going to be able to get a supplemental cost report, and this is going to get you some information around that national observed cost for certain types of services. So you'll be able to compare your cost performance to that national benchmark. You're also going to receive some patient level reports, and those are going to be both in that cost and quality administrative claims measures. So you're going to be able to, as I mentioned in the total per capita, you're going to be able to get some of that individual patient level data that you can really action on and to be able to identify your vulnerable populations. And some other feedback that's kind of hidden in there is that items and services that's found on the main page. Items and services. This data is looking at your attributed beneficiaries across the different services that you provide. And these are really determined by those HCPCS codes. It's definitely used just for informational purposes. There's not a whole lot in there, but it does give you the number of beneficiaries that it's applied to, the overall costs, and the overall service amount. Something else to consider is that this could be a little different depending on what services you provide. It's going to vary. If you have things like anesthesia, GI, radiology services, then you're going to be able to see those on there. You might not see all of these trigger. And then finally at the end, you're going to be able to see emergency department utilization. This is something that I find very helpful to look at the percentage of patients that are high utilizers, your attributed beneficiaries, and how frequently they attend or they utilize emergency department services. Now, just as a caveat, this information is not used to roll into your MIPS performance score, but it's also just some additional information that you can have around utilization for your beneficiaries. I know this is a lot of information, so let's kind of go back and talk about this stepwise. How do we start tackling this feedback? Well, first, we want to take that 30,000 foot view and look at overall what across all of our categories, what are those categories that probably need the most attention for us as an organization. And so you're going to want to try to start your plan based on that. If you look at quality as a potential vulnerability and an opportunity to increase your performance, I highly suggest that you work with your advisor. We start digging down into those individual quality measures and that individual performance to really start optimizing your measures. Look at the measures that you submitted for 2023. Are those still viable measures? Are those still reportable measures? Are those still measures that are meaningful to your practice? Then I want you to take a look at your PI scores. You're going to want to compare your historical scores with your current performance. Again, your advisor is here to help you with that comparison and to track your progress along the way. It's an opportunity for us to ID vulnerabilities again around promoting interoperability. And then you're going to want to review your special statuses to see if anything has changed. So if at the group level or at that individual clinician level, depending on how you submit for the program, you might earn some special statuses that can give you some additional flexibility. Want to let you all know too that the targeted review deadline, we want you to try to work on submitting that as early as possible so that you can get information to make some informed decisions. We do anticipate that that window is going to open up in August, and it does open and remain open for 30 days. So depending on that timing of when it's released, we do anticipate that likely it will wrap up in September. We will be sending out a blog post to let you all know though when it's opened up and then when the deadline to submit a targeted review will be determined. So keep your ears open for that. Your advisor will also be there as well to help guide you through that process should you need to submit one. And then additionally, everybody's favorite performance category, cost measures. We strongly encourage you to download your beneficiary level data. It is a lot of information, but we are here as your advisor at the REC to be able to help you dig into this measure, to be able to identify your vulnerable populations, patient encounters, where you are over your cost averages, different things like that in those breakdowns of that beneficiary, that patient level detail. I also want to make sure that I remind you of our next webinar that is coming up in August. It's going to be on August 20th from 12 to 1 p.m. It is a live client-only exclusive webinar, and we're going to walk you through some of CMS's proposed changes for performance year 2025. We're also going to talk about some retrospective changes that CMS is proposing for 2024. We strongly encourage you to join this webinar, and we also strongly encourage you to reach out to CMS to submit comments. They are actively seeking comments on this proposed rule, and we will also give you the information on how to go about submitting a comment. CMS uses your feedback to really help drive and shape the outcome of this program, and so we want to make sure that you all are informed of any of those regulatory updates so that you can help strategize for your organization and to set yourself up for success in this program. We don't want any of our clients to ever receive a negative adjustment if we can help you keep from it. We want to keep all of that funding here in the state of Kentucky. And just one more thing, I do want to share our upcoming REC annual conference. It's going to be held this year on Thursday, October 24th at the Campbell House here in Lexington. There's a couple different options. You can either attend in person or virtually. And please take a few moments here to scan that QR code and take a look at our website. We're going to be talking about a couple different things, including quality improvement. We're going to be having a panel on social drivers of health, hospital PI, HIPAA compliance, and many more things. So we hope that you can either tune in with us virtually or even better, be able to join us in person. Thank you so much for your time today. As always, please reach out to us. Please reach out to your advisor. We are here to help you with anything that you need.